Hi, everybody. Hello, everyone. Welcome to the Real Talk Show. I am your host, Malongo Manga. Before we dive into today's amazing topic, I would love to acknowledge last week's show, which was beautifully hosted by Helen Zulu. If you missed it, don't worry, you'll catch it on our YouTube channel, the youth platform, and you'll find other amazing shows. Today is a special show because I actually have a co-host. Allow me to introduce my co-host, who is Faith Malambo. Welcome to the show, Faith.
Well, thank you so much. It's an honor to be here, and I'm super excited to be part of this educative and interesting conversation, knowing pretty well that I'm sitting on Zambia's largest adolescent and youth
Yeah.
network platform, which gives me the honor to actually express myself. I don't know if I'm an adolescent, but yes, as a youth, to be heard and to just know and be acquainted with what is going on around. I am super excited, and thank you for having me today.
No, we are also very excited to have you on the show. It's amazing. It's something so rare, having a co-host, and it's just beautiful because we're going to be getting insights from everybody. Yeah.
That is really interesting. I hope we can do this and make sure that we're fun.
Yeah, we got this. All right. We would love to introduce other guests that we have on the show. So today we are joined by 𝗂𝗵𝗵𝗶𝗿𝘁, who is a youth representative under TYP. We are also joined by 𝘂𝗵𝗵𝗀𝗀, who is a Southwest Bureau Chief at Times of Zambia. And our most important person on this show, 𝘁𝗁𝗂𝗃, who is our sign language interpreter. Welcome to the show, everybody.
Thank you and good afternoon.
All right, good afternoon. Thank you
Well,
so
before
much.
before before I can even go, I feel like just when you introduce the guests, I'm super excited because I feel like our panel of guests today is packed with what we really want. We have the president. Is it the president of the which 𝗁𝗁𝗃 University, Levi Mwanawasa?
Now that's
Is
that's that's the depressing part of it all. We were supposed to have the president from Levi Manasa Medical
and he's
University,
not
but
here.
no, imagine. You can imagine.
But it's okay. It's okay. It's still a great panel of guests, and I hope that we're going to get the momentum that we are trying to build today.
Exactly. Iga,
Yeah.
we didn't hear your voice. What's going on?
Hi, good afternoon, Malungo and Faith. I love how you guys are going back and forth with each other. That's interesting. It's amazing to watch. So I've been keeping
It's
quiet,
totally
trying to just enjoy the moment. I'm trying to,
it's Tonga
savor the
ladies,
moment.
Iga. It's Tonga ladies. Get used to this.
Definitely, definitely. Good afternoon to you, and I'm looking forward to our conversation today.
Okay, good, right? Good. So we're going to start with you actually, Iga, since you are the one who decided to be quiet. So we're going to bring you right out just now. I'm well aware that you have attended some of the district indabas that have been hosted. Would you just tell us a little bit about what you think about them, your experience that you had, and yeah, how they'll actually help to inform the people at the provincial, since now we are moving on to the provincial indaba. So can you just tell us a bit about that?
All right, thank you. Thank you so much, Malungo. I think I must start with I must start by mentioning the fact that it's an amazing experience to see the 𝗁𝗃s coming to life, especially considering the fact that I was present at last year's Regional Adolescent Health Indaba, where the health minister made a pronouncement that there would be an extension from just the Provincial Adolescent Health Indabas to now District Adolescent Health Indabas. This was a pronouncement made by her, and it directly speaks into what the youth platform has been pursuing for a very long time, which is turning political will into political action. Seeing that happen is an amazing experience in
Yeah.
itself. But there was quite a number of things that happened at the 𝗁𝗃s, quite a number of lessons to learn. And I think this will always stand out for me. And I'm always going to mention this about TYP and all of these events that we get to have. The 𝗁𝗃s were nothing short of youth involvement. Uh, the lessons that were there were basically showing the power of involving young people, involving adolescents, in engaging their communities. and
Yeah.
and all in all, just coming together in order to sort of address or drive the narrative concerning their health or determinants of their health. So it was an amazing experience. And also, talking of the Indabas, it is my hope that the provincial Indabas can basically just be a build up of what happened in the district adolescent health Indabas, so
Yeah.
that we will basically just be scaling up this youth engagement, getting an opportunity to share different views on the best practices of health between these districts, and also, most importantly, advocating for these policy changes that address the identified issues. So, all in all, that is what the district adolescent health Indabas have been about. And I'm super excited that now I think we have already actually even started having provincial adolescent health Indabas. I'm excited for what's to come in the 𝘗𝗺𝗊𝘁.
Okay, that's really amazing.
Okay, that was quite an experience, and I must say, I hope that in as much as you were learning, you are implementing what you were learning.
Exactly,
Most
exactly. I
definitely,
love
most
that. I
definitely.
love that.
So now moving on, moving on to your second question, not to let you go so fast. We all know to say, the platform obviously, and the main goal of this is unifying and getting to hear the young voices with the ultimate goal of developing economically and social development of the country as well. Now, based on the experiences that you have heard, or maybe that you have witnessed, and obviously with the past the high that has been going on, what are some key issues that you hope to see addressed at provincial level? This is in regard with probably what was happening at district level, and also the things that you could have noted from there. What are the issues that you would carry with you that you see these should be addressed, not repeated, obviously?
Oh yeah, oh yeah, oh yeah, most definitely. Thank you, Faith, for that particular question, because I mean we attended those 𝘗𝗗𝗁 with the core purpose of identifying what the key issues are in these districts, and also going a step further and identifying not only specific districts, but also what is standing out to be common in this particular district, what's common in 𝘁𝘁𝗀𝗃, what's common in Lundazi, what's common in Mansa, what is that one thing, what are some of those things. And I think that from my personal assessment, some of the things that could possibly be issues that I hope to be addressed even as the provincial health Indabas are coming up are things like sexual and reproductive health services, mental health support, and also issues like addressing gender-based violence. And also, one other thing that has been quite a conversation is the issue on the age of access. At what age can young people be able to access sexual reproductive health services? I think those are some of the key issues that really came out strong, and I'd like to shed so much light, or like bring it out as a highlight. The issue of the age of access remains an important conversation to the young people, and it keeps on coming up and coming up and coming up and coming up. Even in last year's RAHi, when we had a side session on higher learning institutions, I was part of that particular side session, and I was one of the people that were leading the conversation. And again, that's also another thing that came up. We had quite an interesting conversation, and even after the RAHi, it has continued. It was quite fascinating to see that even during these 𝘗𝗗𝗁s, that particular conversation came up. So I think that we could carry it a step further and be deliberate enough to also discuss it even in the provincial adolescent health Indabas, just
Yeah.
to see what the way forward could be insofar as that particular issue is concerned. It's a concern for the young people, the adolescents, and I hope that it could be looked into, as soon as possible, because currently our law, the Children's Code Act, is setting a standard as 18, when we know that young people could get involved in sexual activities at
Even before
an
they're
age
18.
way before 18s,
Yeah,
and
true.
you see sometimes they may not have the opportunity to like access these services with their parents present. So yeah, that's an interesting conversation, and I hope that can be carried forward to the 𝗵𝗺𝗽𝗲.
Yeah,
Thank you.
and just to add on, I think one of the other topics that I've realized that are really being a problem, or should I say a problem or something that people want to hear about, is mental health. I feel like mental health is too closed up, and people don't really understand how important mental health is. Sometimes people will just be thinking, only because I drink so much alcohol. Maybe this person just doesn't have money, but they don't really know what somebody's going through mentally. So I feel mental health should also be one of the topics that should be highlighted so that people can now start to understand, because we've had a lot of suicidal cases in our country, and we all know what's leading to that. Mostly it is mental health issues. So it should be one of the important topics that should be talked about. Yeah. And when you see Malu, you know that there are gifts taking part on the show. So I'll just love to inform you, our viewers, that today we are giving out 3 t-shirts to 3 lucky winners. Definitely, Faith and I are going to have some amazing questions for you concerning everything that will be talked about. And as usual, those who are giving us the first correct answers will be part of our lucky winners. And we are also going to announce the people who are going to attend the RAHi. We are announcing 2 people who are going to attend the RAHi with us. I hope everybody is looking forward to that. Mr. Kelvin, you've been too quiet. Don't worry, we are still here. Okay, so Mr. Kelvin, I can see here we're having Southwest Bureau Chief Times of Zambia. Can you just tell us a little bit
My
about
interest
yourself?
is in Times of Zambia, actually.
Thank you. Please tell us about yourself. Everything here is interesting. Bureau, I know there's money and I love money. Times of Zambia, just tell us about yourself and what exactly you do.
Okay, so my name is Mtenda Kelvin. I hail from Southern Province. I'm based in Livingstone, but
You're from
as we speak
Nigeria.
right
Oh,
now, yes. So as we speak right now, I'm in Samba,
okay.
for work and trainings. So I work for Times of Zambia. So Times of Zambia is the government-owned public media. So it's print media. Okay, so when you hear people talk about public media, these are media houses that are owned by the government of the Republic of Zambia. So you talk about public media, you talk about 𝘁𝗵𝗃𝗵𝗃, you talk about 𝗁𝗏𝗃, you talk about Daily Mail, you talk about Times of Zambia. So those are public media. And so on the electronic side, you have 𝘁𝗵𝗃𝗃, you have 𝗁𝗏𝗃. Then on the print side, that's where you have Daily Mail, you have Times of Zambia. So like I mentioned, I'm based in Livingstone. Currently, I'm in charge of Southern and Western Province. So when you hear bureau chief, it's just a simple term of saying the one in charge. Okay, these are just technical terms. It's just like you say, officer in charge, sister in charge. Yeah.
Yeah,
So that's what
yeah.
basically a bureau chief means. It's not about money
Oh,
or bureau
money.
de chain, no.
I just want money. Let's
Yeah.
go.
So yes. So I'm in charge. I also belong to the Livingstone Press Club. I'm also district coordinator for the media network on child rights and development, MNCRD. I'm a child rights activist. I also belong to a network that deals in issues of sexual and reproductive health rights and commodities. Yeah. So basically, unless I've left something, I'm married with 2 kids, beautiful girls. Yeah.
That
Yeah, I think
that
basically
was
that's
really it was. I think you have quite a lot to your profile, except I'm a little bit
yes.
disappointed because what I thought the bureau was for the money, but it isn't. So we'll leave it there.
Yeah.
Now,
No, we'll
Mr.
create one in
Kelvin, I
future.
think you are very
Yes.
for me, I would say this is a very critical aspect of having you here because now you are in the media, and so far, to be honest, there has been really less or none of, you know, adolescent concerns when it comes to young people. It has been more of politics here and there in most of the, you know, prints that we have been seeing. Talk about Daily Mail and many others. We have been seeing more of, you know, politics and less of what is happening with the young ones. Now, how do you think print media can effectively report on adolescent health and well-being issues? Of course, so many challenges that are happening. Like she earlier mentioned, my very own Tonga lady, she talked about mental health, and you would agree with me that mental health has been one of the hugest challenges that we have been facing as young ones. You know, people have been committing suicide, but apart from suicide, I feel like even a person who's working, you wouldn't know that they're mentally unstable. Trust me, because there's a whole lot of things that are happening, and less has been tackled or even dealt with. You know, there has not been proper sensitization on some of these challenges, and obviously how are you effectively reporting on adolescent health and well-being issues, and what are some challenges you face when reporting on them, because there has been less or none actually?
I would say you're right. We are, as media, we are the biggest culprit in terms of issues of adolescent and just generally young people. Our concentration has been more on politics, on issues of governance. Okay, and for me, firstly, what we lack is specialization. Okay, we don't specifically have journalists that look at issues of young people. Okay, so for example, I'll tell you myself. I'm a culprit myself. I really do those stories because just as an individual, I'm supposed to look at sports issues, I'm supposed to look at governance issues, health issues, issues of sanitation, and it's just one person. So it depends sometimes with which area looks much easier. And I sit down with colleagues and I go through our papers, other newspapers, and I see we're not doing much. And like you said, young people have not been given the space that they need in the media, so be it electronic media or print media. One is because others will tell you issues of young people, issues of health don't sell. Okay, so sometimes we fight with the people in marketing and advertising because they'll tell you if we talk about the politician so and so has done this, everyone would want to see, everyone would want to go on social media, isn't it? Okay, when we hear this one has insulted that one, everyone wants to go there. But we talk about issues of young people, you find that very few comments. You get very few comments, very few fights. So others say, no, we are not prioritizing issues of young people or children because we want the papers to sell. Get the point? So one, we haven't created a platform. That's one. Then two, young people themselves have not come forward, okay, to create a narrative. Because if you want an agenda where issues of young people will be prioritized in the media, young people should be the first ones, especially issues of adolescent health. They should be the first ones to come and say, oh, Mr. Mdenda, I think you are doing us a disservice. Every day we see you write stories on a daily basis, but it's all politics. So first, young people should take up the challenge and put us to task where we need to prioritize your issues. Then the second part is that in the health sector, there are these also bureaucracies. Okay, if for example I want to do a detailed piece on mental health, I would need expert analysis and also a lot of details from the government itself, from line ministries. So you realize if I want to get something from Livingstone, an example, Livingstone District Health Office, sometimes they'll refer me to the PS in Lusaka. Okay, and you and I know that news has to be there and then. Okay, it may be stale. So if I'm looking at issues of young people, I need to have information at my fingertips. Sometimes I'll get in touch with QIP, they'll tell me, okay, give us a week, we'll respond to this. So for me, I don't have time for a week. So these bureaucracies that are there, so access to information on issues of young people is very limited. That's one thing we need to look at. And I would agree with you, like, even on issues of mental health, we've given it a deaf ear. as the media. People are dying every day. At some point myself, I didn't realize that I was actually going through some form of mental health disorder. Okay, because I was working too much, having less sleep, but I couldn't get it. And at some point, I was breaking down. Until fortunately enough, someone saw it that I had issues of mental health, and it was really depressing. So as a country, we have not done much. As a media, we have not done much. Okay, to create that narrative where young people, adolescent issues are actually prioritized. Okay, I think should be Edgar
If
mentioned about the
I
issue of
don't.
the. Please go ahead.
Sorry, I didn't want you to move. I wanted to ask this question before you even proceed. Which one would you advise is better as a person who's in the media and have got the access to the journalists that are bringing you the news that is needed? Now, in the case where we, the young ones, want to be heard and to be seen, what do we do? Should the youth walk to the media, or the media should walk to the youth to source for information and have the urge to be heard by the country? Which one is better?
We need to complement each other. Okay.
Okay.
You need to come to me. I need to come to you. We need to meet at a crossroads and create this platform. Because if you don't come to me, I'll feel you're not interested. Okay. If I don't come to you, you feel I'm being biased and have areas of interest. Okay. At the end of the day, we'll be crossing paths in a very negative way. When you see me, normal politics, you see. So you young people, so young people should create an agenda and come to me. It is your right, for example, public. It is your right to come to my office and say, I want this issue published. I want this issue advocated for. Okay, because no one tells us to put politicians in limelight. Mostly they don't tell us. We are the ones that actually give them a platform. There are certain politicians I'll tell you I write about them, but I've never met them before. But I write about them. That's the scenario I want with young people. So that even as you have this agenda, as you want your issues to prioritize, you put me to task, you are also available. And so remember, I sent you an email that day. Where's the story? Remember, I gave you a scenario about this question. What did you do about it? So we want you to come to our offices and say, we want a page specifically dedicated for young people. For example, in our newspaper, we have a page dedicated for politics, we have a page dedicated for sports, we have a page dedicated for gender. Okay? We may not have a page dedicated for this issue. So that's where you come in and say, okay, whichever newspaper A, newspaper B, we've gone through, because now even you, I want to tell you something that needs to be, as TYP, you also need to start doing what we call media tracking. You come to me and say, for the last 3 months, Mr. Kelvin, you've not done any story on young people, or for the last 1 year. So put me to task. Because you've not done, we expect you to do this in the next 3 months. And you push, because you come to our office and say, want a page dedicated for young people. Yeah. When you come to my office and say, want a page dedicated to young people, I also escalate it to my bosses. Young people in Southern Province, they want a page dedicated to their issues. But also, you also need to be providing me with content. So if I say I dedicate a page for you, you also need to be providing content for me. And that's what you are doing. I was put tasked by even your executive director, and he challenged me. And after he challenged me, I went to my books, I went to my newspaper. It was nothing for young people. So I said, okay, TYP, I've rendered my services for free. So anything that you have, make use of me. So even myself, for example, I'll speak for Livingston. Livingston, there are about 15 media houses. I'm able to talk to the 15 media houses to create a platform for young people to have their issues and for them to thrive.
Yeah, and just to support Times of Zambia, I liked the point where you were saying the media is not doing so much, the government is not doing so much, but you forgot to mention that the youth are also not doing so much. Because you might give us a story of Ben Lombe and would be so excited and would be
You'll be
wanting
everywhere, yeah.
Exactly. But then when you give us a story about things that really affect us, there are a few people who actually react to that. So I feel as youth,
Yes,
we also have to be the drivers and make sure that these things are actually coming from us because we are the ones who are
yes.
facing them. So we don't expect the media house to come and drive something that we are facing. It should come from
Yes.
us. So yeah. And right about now, I
So
think we would
it's
go down.
about okay. I was trying to say that's about priorities. You need to have a stance where you say nothing for us without us, and if you
Yeah.
have that stance, then you see numbers will grow. Because adolescent people, for example, in Zambia, very few have access to even sexual reproductive health commodities. But
Yeah.
no one's talking about it. Young people every day, each day in there, young people having sex. But how do you find a way of protecting them? Because even these issues of mental health, they come as a result of young people having involved themselves in sexual activities, and because no one is supporting them, they feel they are dead. Someone becomes pregnant, you condemn them like the world is over. You try to go to a teacher, your teacher condemns you more. Then what are the modalities that should put in place in making sure that these young people, because of their actions, they're not affected by issues of mental health?
Okay, thank
Thank
you
you.
so much for that submission, Mr. Kelvin. Right about now, we'll go down to the comments. I can see my people are so eager. Comments are just coming through. So we're going to have one from Yundo, and Yundo is saying, following from Lukulu. Where is Lukulu exactly? Anyway, we'll have that discussion, Yundo. Thank you so much.
Lukulu is in Western Province.
Oh, okay. Oh, wow. We have people from all over. Another one from
Yes.
Naomi Mwinga, watching and following from Choma Town. Thank you so much, Naomi. The other one we have from Jacqueline, watching from Chipata. Thank you so much, Jacqueline. Oh my God, people are so spread today. We have Western, Southern, Chipata. Another one watching from Mongu, Western Province. Thank you so much, Kababu. I hope I pronounced that right. Jacqueline comes again. The discussion is really interesting. Looking forward to the RAHi. Also looking forward to seeing you, Jacqueline. Surely this is going to change the lives of many adolescents out of their particular health wise. Yeah, particularly health wise. The RAHi is there to change us, it's there to teach us, it's there to help us. So don't worry, Jacqueline. This will definitely do for you. Another one from
Jacqueline
Jacqueline.
is
Not,
really busy.
I know. Only mental
So
health.
this was still from
Yes,
Jacqueline. It's saying not only mental health, but also some physical and emotional challenges too are equally a leading factor to adolescents' poor health performance. In most cases, there are the challenges mostly leading to societal issues.
mental
Hmm,
health.
very
I
true.
love
Mental
that.
health. And
Yeah.
I feel like some of these things that we are okay, there's a different one from Grace Musisika. I think the other challenge faced by young people is means of getting to these platforms, such as Times of Zambia. We do not know the means of communication to get to these platforms, and hence most youths are quiet. I will give an example of Western Province, where ZNBC Media House has been closed for two
Oh
years
my
now.
God.
How do we access these medias now? That is a
Mr.
very
Kelvin.
interesting question, and Mr.
Mr.
Kelvin
Kelvin.
could be the best to help. So, Mr. Kelvin, you would have to keep this question as we. I've seen somebody has been so quiet for a long time. Mr. Kapambwe has been quiet, and I think he's even thinking of getting to grab a gum or something. So, I have a question for you, Mr. Kapambwe. How can youths advocates like yourself ensure that voices and concerns of adolescents are heard at the provincial Indaba? I read that again. How can youth advocates like you ensure that the voices and concerns of adolescents are heard at the provincial Indaba? Now, as you answer this question, keep in mind and give us a feedback on how the voices were heard at provincial level, because then we would have a better response at provincial level.
Okay, I don't know, but I feel like I'm about to dance around your question. So I hope I'm going to make it. I hope that I'm going to answer it clearly. But here
Mm.
is the thing. I think everywhere you're going to go, what's at the core of advocacy is having enough information, right? And also, once you have the information, from there onwards, you will have enough courage to make sure that you actually do work based off of the information that you have. That's what advocacy is about. You don't necessarily just sprout out of nowhere and you're an advocate all of a sudden. So what I'm trying to say is that the district adolescent health indabas, as well as the 𝗵𝗺𝗽𝗁, are an opportunity for these youth advocates to get correct information, first of all, by being present, by participating, by asking enough questions, because you don't just get to sit in the event without getting enough information. It's also an opportunity for them to be there and ask the necessary questions, and also make the necessary comments, such as even calling themselves out. For example, what we have just talked about, young people not taking a deliberate step to go to media houses and all of that. Those are issues that we must firstly start from telling to ourselves from within these opportunities, such as the 𝗁𝗍s and 𝗵𝗺𝗽s. And by the time we're getting to the RAHi, we will have enough information. We will have a more detailed approach towards a couple of issues that we might want to raise even at the RAHi. So all I'm saying is, while we are waiting for the RAHi to come, even if you're not attending the RAHi, the 𝗗𝗁, at least start taking a deliberate step to check what's happening around in terms of the health of young people, the health of adolescents. That right there is where we are supposed to be beginning from. And in terms of how was the response, how was the participation of the young people in the 𝗗𝗁s and the 𝗵𝗺𝗽𝗁s? I think it's been evident. We've seen enough testimonies. I could personally testify that what's been happening this year, and also this is another, like, it's standing out also for the RAHi. The vision this year was making all of these 𝗗𝗁s and 𝗵𝗺𝗽𝗁s a lot more interactive, to give an opportunity to the young people to interface with stakeholders such as traditional leaders and everybody that's involved in policy making, to create a bigger opportunity for them to actually interface. So even as we are walking towards the RAHi, one of the greatest expectations I have is that young people will have a platform to be able to directly interface with the key stakeholders. These indabas are not just about people coming and pouring information onto the young people. It's about that important exchange between the stakeholders and the young people. So that's what we should be looking out for right now, as an opportunity for us to prepare, for us to go around and check the status quo, and just use the RAHi and 𝗵𝗺𝗽𝗁s and 𝗗𝗁s as opportunities to actually start these conversations.
A lot was said on there, but though I don't know if it's just me. You offloaded information that we needed to hear, but then my main concern was, how do the voices and concerns of adolescents be heard at provincial level with a reference from district level?
I think just to help 𝗁𝗂𝗃 on that one,
Please
I feel
do.
like the district indabas, I feel like the district indabas have been able to invite so many people into them. Like the one that I just attended in Mansa had some media platforms. They had Diamond TV. So Diamond TV was able to give youth out there information of what was going on there, even those who didn't attend the RAHi. And there were some questions that remained not really tackled, and it was really emphasized that these are some of the concerns that are going to be started when we go to the provincial Indaba. So the district is literally just building up, taking the youth to the provincial. And even for those who are not there, like, you are able to get that information. Those youths who come for those Indabas are able to spread, because they were just not there to just talk and just finish up. Afterwards, they were there to go back to their communities and spread it out, so that they can be able to inform people of what they're going to expect at the provincials. So I think I think that way as well also helped just,
Yeah. Because remember that at the beginning I mentioned that the 𝘗𝗲s were a lot more engaging. So
yeah,
that's
yeah,
basically Malungo's point. And so it's about how deeply engaging they were, and now building all the way up to the 𝘗𝗲 and then going all the way to the RAHi.
yeah.
Now, because my reporter took time to answer this question with her beloved,
Yeah.
I'm going to, and because he said he's not, I made him move a little bit on his couch. So let me get to the next question, and this one is for Mr. Kelvin. Now, you may agree with me, or you will agree with me, Mr. Kelvin, that many other times that young ones.
Sorry, can I just cut you just a little bit? Because we have people waiting for t-shirts right now.
Okay, the question.
So let's just have a short segment because I know how the adolescents behave. Right now, they're just but we got you. So before we move on to our last set of questions, we have some questions for our viewers. I'm going to pose the first question, and my co-host will pose the second question. The first three people to give correct answers are definitely the ones who are going to go away with their shirts. My first question is around mental health. I think from the whole time I've been talking, I've told you guys that I love talking about mental health because it's something very important. What exactly do you think are some of the things that are leading youth of Zambia to having so many mental health problems? I'll say that again. What exactly do you think are the main key drivers to mental health problems in our country? The first people who are going to give me the correct answers or the good answers are going to go away with a free t-shirt. Faith, do you have any question for our people?
My question will be from my main interest, to be heard.
Yeah.
So my question is driven from what Mr. Kelvin was saying. Who
Yeah.
is to blame for the voiceless youth within us?
My youth.
Who is to blame for the voiceless youth within us? Is it us or the media?
And while you're telling us who's to blame, please give us a brief reason as to why you are picking that person as the one to blame. So as we wait for our answers, I know people are thinking right now. Faith, you can pull away with the question you had for Mr. Kelvin before he runs away.
Okay, so Mr. Kelvin, my question for you, how can media outlets balance the need for informative reporting with the need to protect vulnerable populations like adolescents? Now, you would agree with me that when you go in rural areas, you will find that a lot of adolescents are going through a lot of things and they can't voice them out because they just don't know how to. And some of them is because they are vulnerable to situations and they just can't express themselves. So then how can the media outlet balance the need for informative reporting with the need to protect the vulnerable population like the adolescents?
So firstly, I would say every citizen, be it a child, be it an adolescent, a youth, another person, deserves some equal share of coverage. So the only thing that is needed is to create opportunities and also to ensure that media outlets, okay, be it traditional or digital media outlets, are easily accessible in every place. For example, you have someone from Ukulu. As a media house, how do I make
Mr.
sure?
Kelvin, we can't see you. Can you just try and adjust your video?
You
People
can't
want
see
to
me.
see who's
Sorry.
answering that question.
Sorry. I think the other part had moved. Are you able to see me clearly now?
Yes, please.
Okay. So like someone mentioned, we need to find a way of ensuring that someone from Lukulu is very far, by the way. So how do we ensure that as a media platform, we create an opportunity for someone in the rural area? Because in most cases, when decisions are made, okay, when decisions are made on young people, in most cases, we neglect those who are found in rural areas. So as a media platform, how do I create? So for example, the question that was asked, like there's no 𝗁𝗵𝐶 in Mongo. For all information, there is 𝗁𝗵𝐶 in Mongo. There is 𝗁𝗵𝐶
Is it
in Mongo.
active? Is it
Yes,
active?
it's active and there's a reporter in Mongo. Then
Okay.
the other platforms like for rural areas, each district, the whole country, if you didn't know, has ZANIS, Zambia Information and News Services, Information Services. They are ZANIS officers. So ZANIS, yeah. So it's like you have ZANIS in Choma, you are in Lukuru there's ZANIS, in Mongo there's ZANIS, and these are media platforms that go down to the rural areas, to chiefdoms, to villages to get information. So we need to strike a balance of ensuring that, in as much as I want to write about developmental stories, governance, or politics, I also create the same opportunity for other issues, especially those to do with young people. I'll tell you, like, young people nowadays are very privileged. Okay, with the advent of social media, young people are really privileged because anytime you can post anything. But the question comes in, when you wake up in the morning, what do you post first? Because those platforms, you can use them to send out a message that can change society, that can change the narrative on how adolescent issues are being prioritized in Zambia, how they're being handled. So even yourselves as presenters, the whole day from 7 to 19, what do you post on social media? Do you post selfies? Do you post what you eat? So it's time for you to start now using hashtags. You know, hashtags have changed the narratives on how certain issues are handled. Because you prioritize and you have people that connect to whatever issue you want to portray or to put out to the whole community. So striking a balance, at the moment I would say it's a bit difficult, but it's a challenge that we need to take up, and it's a challenge that even young people themselves need to come forward. The Edgars of this world, the Chancers, the Shadrachs, the Malunga, the Faith, they need to come forward and actually say this is what we want, and we want both the traditional media and digital media to look into our plight and ensure that we are given priority. For example, when you watch TV, what's the first story? Like 19 hours news, what's the first story? Is it about young people? Is it a story about the developmental aspects of young people or the achievements of young people? Usually to be about politics, to be about 𝘁𝗵𝗃𝗃𝗃𝗃, but you find that if they cover TYP, it shouldn't be like that. So we need to come to a point where issues of young people is a first headline. It's a first headline on the main news. They're talking about young people. How many people have been saved? How many young people have contributed to the well-being of their fellow young people in this country, and how the media has helped to propagate that agenda of the health nation and the health citizen.
Okay, that's amazing. Thank you so much. Thank you so much for that amazing answer. So right about now, the winners are coming. Drum rolls.
I hope I'm one of them.
You would need to answer more to earn it.
Okay.
Yeah, so right about now, we are going to have some comments that are going to be displayed, and those displayed comments are going to be read by my co-host. And if your comment is read, meaning you are one of the lucky winners. That's how it's going to be done. I hope everybody is ready.
Okay, so this one, Nyundo Catherine Mafuko-Chipasha. Oh my God. Faith, to answer your question, I would say it's the media, because they're adolescents who can't open up freely to the public and to some individuals unless if they are being approached and asked to talk about what's troubling them. I agree with this one. And that's why I was asking even Mr. Kelvin when I said the previous question that we're just answering, how do you get to the people that are not heard? Because, you know, if I'm a teenager today and I have been raped by an uncle, it is very hard that I'll open up to anyone. But I would need somebody who would understand to sit and go deep down in thought with me, to encourage me and not to discriminate me or judge me. And these are things that we are going through. You find a little child in grade 12 is committing suicide. Why? What happened? You would think it's only results, but if you ask me, I think there is more to these things than we can see.
Oh yeah, that's very true. So congratulations, Nyundo. You are one of our lucky winners and you got yourself a TY t-shirt.
So
Like,
this
girl,
one, Dorothy Temwani Kayalula. I hope I read your name right. Please don't arrest me. The media is to blame. They are supposed to move or rather engage in program-friendly shows that adolescents would be willing or open to follow up and interaction talks which focus more on the mental health aspect. Very true. I asked that question in the first place because it's very hard for a person like me to walk up to the media. Trust me, a huge number of our population, thank God to our president who has brought about free education. But a person who's uneducated would think it is the hardest of things to approach a media house.
they'll think
Okay.
it's
And
a
not
good
everyone,
process, you know?
it needs me to drive, it needs me to dress a certain way for me to go to a media house and approach a journalist. But then a journalist is trained to dig out information from the deepest source of whatever it calls for. Regardless of status, a journalist has a upper hand, if that's the right way to use. And so my question came, and I agree with what this one is saying. It takes maybe a little more
Okay.
sensitization would help if the media told us
Yeah.
to say, it doesn't matter who you are or where you are from. If you have a problem, walk out and you will be heard. To just break the narrative of who am I to face the media.
Yeah, actually, maybe sorry to cut you short. The person is right, but also we need to reach a point where we need also to appreciate the establishments of community radio stations. I know someone mentioned, it's true, someone may fear to come to a Times of Zambia office or to go to a 𝘁𝗵𝗶 office. That's why now the government is encouraging the establishment of community radio stations. So you find even trauma, you have a community radio station. So this one, for lack of a better term, this one does not discriminate, because you can go there to a community radio station and have your issues heard. But a challenge comes in. Sometimes young people have access to these community radio stations. Instead of championing good issues, they will call radio stations and first request for a song. DJ, play me this one by Beyonce. Eh? Then others will call the stations. No, I'm greeting my neighbor next door. I'm greeting what. You see? So sometimes they cry, I don't have access. So, but that's what they need to do. And say, when you call a community radio station, because usually community radio stations, they have this, number that will be running, continuously running, so that you can call at any time. So use that opportunity not to greet, not to request for confirmation, but to request that same radio station creates a platform for you to be heard. In any situation, I'll tell you one thing that young people, in dealing with issues of young people are very delicate. So there are times, even myself, I would have to remove the jacket of me being a journalist if I'm to handle a situation involving a young person. I've had to deal with issues of children under Media Network on Child Rights and Development. I had to remove my jacket as a journalist. I'll be very honest with you. I've had situations where I walk into this place. Sometimes I go to the hospital, I'm sick, and the people there will be asking what I'm doing at the hospital. No, I said, but I said, it's a hospital. They said, no, you are a journalist. What are you, what are you investigating? Get the point. If you are, when I go to a certain place, I'm going there to investigate something. So there are times that also I need to remove my jacket and deal with issues of young people. if young people feel I'm not doing much, they have the right.
Yeah.
I'm employed. I'm employed to gather information. I'm employed to inform. I'm employed to educate. Then, if I'm not doing that, then I'm not serving my purpose. I'd rather go and maybe become a truck driver. Okay. So if the young people feel we are not there, then there's not something wrong. So we also, together with young people, together with TYP, we can set up an advocacy where we make sure that young people are heard, where we talk to media houses, we talk to community radio stations, especially in those areas where people feel they cannot reach a media house, or maybe they have that phobia to reach out to a media house. We can create platforms. Even this platform is one of them. So we need to identify the gaps that we bridge them. So it's only after we identify the gaps that we are going to reach out to people. I feel sad, like even the comments where you can tell the people that have commented are just representing the whole community.
Yes.
They're not being heard. So if there's someone who feels like that, then I should be challenged. And I'm very honest with you, it's a bit difficult to reach out to media houses and public media houses because they're in this building and the fancy building sometimes. So it's good to go out to your communities, but also the communities need to know who to reach out to, especially that for community radio stations, they have what they call listener groups in different townships. So we can use them also to advocate for issues of young people, to bring them on board so that their concerns are really heard, so that they don't feel left out. Because you may have the situation where young people are affected by issues of mental health, they're not accessing sexual and reproductive health commodities because the media has not given out information. And at the end of the day, become ignorant. We create a platform where there's no ignorance, where everyone is free to go to any media house and where information is disseminated in the simplest.
I feel like today Airtel is on everybody because it was right on my lip. I kept
I
dropping,
think
coming back.
Well, I guess even time is not on our side, but then I'm just glad that a lot of things has been stretched out. My takeaway home, I don't know about you guys, but what my takeaway home to you guys who have joined us live on our various social media platforms is, if you are a youth who's going through something that needs to be addressed, you can't handle it on your own, or if you know somebody who knows somebody, be rest assured that mental health is real and people are going through a lot. Is it an ailment that you have discovered on your body that you can't understand due to early pregnancy or early marriage, and you don't have? I believe there is free counseling at government hospitals.
Yes,
There is free counseling for that. So make a date, visit a hospital. Don't allow yourself to go through depression because of what you are experiencing. You can find someone to talk to. And obviously, today, Mr. Kelvin Mudenda, to all the youths that are following and those that are going to watch this after the live show, you have been given a free passport to approach a media house and lay down what you are going through, so you should be heard. Because Mr. Mudeni said, we are not being heard because we are not speaking out. Probably because we have spoken out on, different platforms, but not to be heard by the multitude as much as we should. So we have been given a passport to be heard. And obviously, I can talk for the whole day, but Mr. Iga has been quiet for a long time. Let him say something before you get to announce the winner.
Well, I don't have much to say. I'm just excited. I'm looking forward to the 𝗵𝗺𝗃𝗃, and also I'm looking forward to the involvement of young people. I'm looking forward to seeing young people energy, and I think it's clear that the signs are clear. It's time for young people to take the stand and play their role and drive the narrative concerning everything around them, including their health, most importantly their health, actually. So I'm excited. Thank you so much for the opportunity to be on the show, and also I'm looking forward to today's winner. You guys have been amazing. Mr. Kelvin, I'm gonna make this public core. I don't know what to call it, but yeah, I would like to be connected with you. So I hope that after the show we could connect, because I believe that, I mean, we shouldn't just talk and say, let's do this. I'm saying this here to set an example. So yeah, thank you so much for all of the information that you put out. You are loaded. And yeah, it's been exciting. Thank you.
We need more time. We need more time.
Okay. Thank you so much, Ika.
Connection.
How many winners have we announced so far? Because as usual, Airtel was on my neck. We have 2 winners so far.
Apparently, I've been told that we're going to have 1 winner per episode, and today we already have our winner. So I don't know if I'm going to do the honors of announcing them, or you will do with all pleasure.
That's your duty. All duty is given to you, ma'am. You can just,
okay, maybe before we announce the winner, it would be nice and fun to announce the winner on the close of our show. So I'll just probably, with a few minutes, 2 minutes, maybe in 30 seconds, to allow Mr. Mudenda Kelvin to just tell us his last remarks as we get to wind up the show.
Basically, for me, thank you for the opportunity. I'm available anytime. It was a pleasure being on your show. It was my first time, and you know, especially where as a media person, you are used to ask questions and not to be asked. So I was actually very shy the whole time, you know. So all right. So no, once more, thank you so much. Let's have this conversation. It should not end here.
Yeah.
Ours is to serve. Whether you work for public media or private media, ours is to serve the masses, and we should not be biased on who to serve. Children, young people, adolescents, adults, senior citizens, they should be given opportunity to be heard, and their concerns must be given to those in charge. And one thing that you need to know is that the government, through the Ministry of Information and Media, has created a conducive environment for all discussions to be put out in all media houses. So thank you so much. I was happy to share the platform with my 2 sisters. Being unfair, 3 Tongas on the platform. Not fair. Not
very happy comment.
Okay, we're actually out of time. Thank you so much. Your words, Mom.
Please, you can give us the honors of announcing our last winners, then we close the show.
Okay, so congratulations to Shadrach Chansa. You have just booked yourself a spot at the RAHi 2024.
Well deserved, because look at how much work Shadrach gives to everybody on this show. You know, everybody's included in our show because of Shadrach. Congratulations, Shadrach, for getting yourself that opportunity to get a spot at the RAHi 2024. So we have come to the end of our program. Today we have gone deep into time, which just tells us that the conversation was amazing and it was beautiful. I would love to thank our amazing guests who were here with us at the show, and I would love to thank our amazing co-host who was able to just bring out her information also to everybody on the show. Thank you so much for tuning in. It would be lovely to see you next week again. Bye.
Bye.